The Canadian Association of Clinical Thermography is dedicated to making thermography more accessible and available to those who seek it. Become a supporting member today and help us transform the way medical thermography is understood in our world by practitioners and the general public. Visit us today and join us.
All right, everybody, welcome to this month's Practitioners Webinar Series from the Canadian Association of Clinical Thermography. We've been delighted to be offering these monthly webinars and always excited to see the incredible demand and reception of them. So thank you, and thank you for being here today. I'm going to just give a little bit of housekeeping first. Many of you have been on our webinars or you've been on a webinar, so you'll see at the bottom of your screen Q&A. So you're welcome to put your questions into the Q&A. I think you can also put it into the chat if you'd like. I will collect them and we'll raise them at the end during the Q&A session. And other than that, I am going to introduce you to our wonderful speaker. Again, those of you may know him, and those of you who don't, you'll get to know him. This is Alexander Mostovoy, who is a clinician, researcher, public speaker, and best-selling author of Breast Cancer is a Preventable Disease. He's a recognized leading authority on breast health and cancer prevention. Alexander achieved a doctorate in homeopathic medicine and science, and after devoting over 20 years of his clinical practice, specializing in women's health and disease prevention, he now focuses his full-time efforts on clinical thermography and research in this field. He is the past president of the Homeopathic Medical Council of Canada and the current president of the Canadian Association of Clinical Thermography. Alexander is a sought-after speaker on breast health, disease prevention, and thermography. He has lectured extensively to physicians across the United States, South America, and Europe, educating them in breast cancer prevention and the use of medical thermography. He enjoys spending time with his wife, that's me, and family, and educating people about health and wellness, listening to classical music and opera, and quiet fishing getaways. So that's a little bit about Alexander Mostovoy, but you'll get to know him a little bit more now. Take it away.
Thank you, Tally. For those of you who haven't attended previous webinars, I want to welcome you. And for those of you who have attended previous webinars, I want to welcome you back. So today we're going to be talking about an interesting subject, and that's the subject of thermal imaging and sports medicine. We have had different themes every once a month, from breast cancer to diabetes to dental pathology and thermography, and today sports medicine. This has been chosen by one of our participants. So if you have interesting subjects that you'd like us to cover in the future, please write to us, email to us, or text us, get a hold of someone, and I'll definitely consider covering the subject. Now, why sports medicine? Well, I think it's really well suited to what we do with thermography, and hopefully by the end of this webinar, you'll figure out why. And I think it's going to be one of the primary imaging modalities when it comes to sports medicine specifically. So what we'd like to do is, let me give you kind of a brief introduction for those of you who are new to the subject. Why thermal imaging? Well, thermal imaging, or what we kind of commonly call thermography, it's a technology that captures the heat emitted by the objects to create an image known as a thermogram. The process is basically based on infrared radiation that naturally kind of emits out of our skin. And it's been captured by a special infrared camera that digitizes the image, creates an image for us to analyze. Now, there are various temperatures that are depicted through different colors. As you can see here, darker colors are cooler temperatures, and lighter colors are warmer temperatures. So you'll see a color scale on the side of each and every image. Maybe not this one, but that's why I'm explaining it. And that gives us a particular heat profile. So that allows us to kind of move further in terms of our analysis. Why specifically the importance of thermal imaging in sports medicine? I'll tell you why. The most important thing is not detection. The most important thing is prevention of injuries. Now, in professional sports, as you all well know, in professional sports, what happens is that these athletes are not just jumping out of the airplane, as you can see here, but these athletes are naturally prone to injury. And when you're paying your players millions of dollars per year, or let's say $500,000 for each and every time they show up for a particular event, you are under a contract to them to pay them whether they're injured or not. Now, if your main player or some kind of important players, we'll call them business assets, are not performing because of the injury, naturally, all this expense is going to waste. So by assessing various skin temperatures through thermal imaging, we can help identify inflamed or injured areas before they become kind of more severe. So this technology allows us to spot potential injuries by detecting abnormal temperatures. And look at it this way. Whether you're playing soccer or you're playing hockey or any other sport, let's say tennis, naturally, you're not going to bring in an MRI machine on site. You're not going to bring in an X-ray machine on site. However, with the mobility of thermal imaging technology, which is maybe just a handheld camera and a laptop, not even a laptop, you can connect it to your smartphone, you can quickly kind of detect the asymmetrical issues that may be seen through either muscle overload, regular inflammation, asymmetrical muscle function. All these issues can be done on site very quickly. So in sport medicine, professionals can use this data to tailor further on, let's say, rehabilitation or even training programs that will give you significant kind of advantage, one, in reducing risk, and two, in enhancing your athletic performance. So how do we assess temperature? Well, skin temperature is well recognized as a critical physiological measure, not only in sports medicine, but in medicine generally. But today we're just going to kind of talk about sports medicine. First of all, it's non-invasive. Again, you don't have to radiate your subject to get very important information. And secondly, it allows you to monitor effects of training or performance in real time. So when it comes to prevention, it's very important to understand that the earlier we can detect some form of abnormality, the sooner we can intervene, whether it's the intensity of training, whether it's implementing recovery or preventing injuries. I'll show you some case examples in a few minutes. But what I want to kind of relay, which is a very important subject, is that the assessment of autonomic nervous system, which is basically control your skin temperature or your temperature, and different temperature fluctuation can provide an insight into activating the sympathetic and parasympathetic nervous system. This is how your body will manage stress and recovery during and after physical exertion. So you can optimize your training regimes, and generally, this is going to provide a critical tool in terms of, as I said, better injury prevention and management. For instance, I'm not sure if you all remember the great Michael Phelps. I think it was 10 or maybe 15 years ago at some Olympic event where this individual, I think he brought in 6 or 7 Olympic medals, if I'm not mistaken. This kind of broke a record for any athlete in terms of Olympic medals. So he's really quite a phenomenon, not just in terms of swimming, but just as a kind of general kind of athlete. Now, the thermal imaging, as I mentioned, is used in sports medicine. There was a study published, a prominent application has been used in Olympic swimming, where thermography helped identify muscle load, inflammation, insufficient flow of kind of thermal patterns, which are the precursors to injuries. What these studies have shown that thermal imaging to monitor swimmers can detect early signs of overuse injury. And that definitely will help in terms of prevention of damage to facilitate proper recovery strategies. Before we get into imaging, it's very important to follow the right protocols. Because it's not just a matter of getting a handheld camera. You really have to know what you're doing with this. So there are pre-scan procedures, which basically follow in medical thermal imaging as well. That is proper acclimation to avoid temperature discrepancies caused by external factors naturally. If a person is not acclimated properly, you're not going to get the right kind of results. Then there is a scan technique. It may be things like what is the proper distance, what is the proper angle to the subject in terms of imaging and positioning. And finally, if all of that is done appropriately and up to the protocol, then we're looking at analysis. Again, it may seem simple, but like everything else in life, it's simple once you know how. So identifying abnormal thermal patterns takes quite a while to kind of understand the physiology behind them, and you also have to have baseline levels to spot various variations. So there are standardized protocols or methods to make sure that infrared imaging is used effectively. Okay. Now, when it comes to proper technique, remember that body posture is very important. Now, here we have on your left-hand side, body posture. On the right-hand side, it's not necessarily the same person, but just for illustration purposes, you're getting proper positioning. Why is it important? Because if we're looking at, let's say, lower extremities at this person's knees, we want to make sure that we're getting left and right view that allows us to have perfect symmetry in terms of positioning. Because when I look at all this and trying to analyze this, if the angle is not correct, I'm not really getting a correct point of view, and therefore I cannot give a correct interpretation. So that's very important, and I just wanted to bring this up. Now, this is an image, an infrared image, I should say, of a professional soccer player in the Spanish First Division club. These are kind of elite athletes. And as I mentioned before, and most of you who are familiar with thermography would know that usually we have a color scale on the side. In this particular case, I just want to bring your attention that it's at the bottom. Basically, it's the same thing. And the thermal window here is from 34.9 degrees, which is the upper limit here, and 28.3 degrees, which is the lower limit here. So darker colors are cooler temperatures, lighter colors are warmer, sorry. And naturally, if I were to look at this, I would definitely kind of start paying my attention to this particular pattern. Now, the pattern is not necessarily asymmetrical. There is a very, very vague kind of pattern on the other side as well, which is fairly symmetrical as well. I'm not sure if anyone can kind of see this. But what's important here is that there's definitely inflammation or vascular dilation of this particular pattern here. Now, the patient can be, or I shouldn't say the patient, this particular athlete does not have to have symptoms. They may, or they may not. But if I were to look at this, if I were on the field with this particular athlete, I would say, I'm sorry, even though you may not have symptoms yet, I think you're sitting the rest of the game, you're sitting this one out, and we will try and figure out what needs to be done to kind of get you back to normal, because this is a very high probability that this is already an existing injury. Right knee injury, you can see the agony on the face of this particular soccer player. And at the same time, you can see the injury with infrared kind of image as well. Now, I know most of you who are prone to watching soccer players, sometimes they're called kind of good actors because they want to draw the attention of the referee, and whether or not they're injured, a lot of them practice kind of the art of faking maybe injuries sometimes to get an advantage. I don't know whether it's acting or not, it doesn't really matter, because you can quickly take a look at the site of potential injury and say, no, he's not acting, he's actually in agony. So in this particular case, you can see that we are looking on your left-hand side, there is an anterior aspect of the knees. So we have two knees here. Here is a problem area, which ends up being fractured right tibia and fibula. So the tibia is the bigger bone and the fibula is the smaller, the one behind. Both of them were fractured. And this is 3 months later after therapy. As you can see that things are kind of going back to normal, which is fairly symmetrical presentation. There's a little bit of heat left here in the fibular kind of region, but compared to what we see here, it's quite an improvement. So you can also use this imaging modality to see the progress of therapy as well. Here we have a view of knees with a triathlon athlete. And what I wanted to draw your attention to is the following. This particular area here. Naturally, there's some existing injury already. And again, whether or not the patient wants, the athlete wants to continue with this kind of triathlon. I'm not sure whether it was taken during or after, but if this is kind of looking at this in the middle of an event, I again would certainly pull this athlete out of this event because of the injury already, which is going to only get worse if they continue. So they may finish the event, but they're not going to be doing much after that for a very long time. So you can see how quickly you can get to the root cause of a problem. You can assess it. Again, you don't need an X-ray. You don't need an MRI right on the field. Naturally, you can escalate that after the event, but during the event or right after, right on the field, in real time, you can assess the problem and act accordingly. Here we have an IR image of the medial aspect of the right leg. This is a 26-year-old professional football player, and we have heat in the Achilles region. Again, very quick assessment, right to the point. Where is the injury? How severe is this? And here you can make a decision whether or not to pull this athlete out of the game. This is a posterior view. In other words, from the back, we're looking at right leg injury. There's injury in the medial aspect here. There's, of course, injury kind of all along this side as well, which is absent here. And when it comes to thermography, a lot of people don't realize this, but it's a fairly kind of comprehensive assessment. When we look at left and right, and this is kind of the back side of the right leg, we're always looking for symmetry. Now, symmetry in some artistic circles is considered to be very boring. I may agree with that, but when it comes to your health, it's the best thing that goes for you, because symmetrical presentation is usually a healthy presentation. There are always exceptions, but 99.9% of the time, if there is something asymmetrical, we have to kind of immediately inquire as to what exactly is going on, what is going on here. Now, again, maybe symptomatic, maybe asymptomatic, doesn't really matter. There is a big problem here. Next, this is published by a study that was published in 2015 by the Federal University in Brazil. It's from their database. And here we're looking at thermal asymmetries in the knee and the anterior leg. So where is the asymmetry? Well, the asymmetry is focused here and here, right? You can see it as well. And the asymmetry is focused in specifically in the tibial region as well. So fairly quickly, we can see what's going on and what needs to be done next. I just wanted to kind of just copy and paste. This is from a website called BraceWorks. And this is a published study of infrared thermography, a support tool for orthopedic diagnosis. This is also done from Journal of Medical Imaging and Health Informatics from Spain in Madrid. So here we are also looking at potential injury here. When you're looking at these structural things, this is what we call mapping. I'll get into mapping in a minute, but it's kind of an important aspect, and it's something that is going to help with machine learning or artificial intelligence. it really helps kind of in terms of machine learning. Mechanism of injury. Now, here I'd like you to point out that the image on your left, right, is basically shows us potential kind of which muscles and which areas are going to be activated with this sort of motion. As you can see, this athlete is in the middle of jumping and throwing, and this is not a natural position for anyone to be in. Naturally, of course, they're trained to do this. They do this day in and day out. They train, they play. But in the middle of a game, this is what is going to be activated. These are particular muscles. Now, naturally, that's not the only thing, but just for illustration purposes, I just wanted to bring this up. So where is the mechanism of injury? Well, the mechanism of injury could be twisting, could be physical trauma, of course, as well. But in this case, there is no physical trauma of a blow to the side. Here is something that overusing the muscle or overstretching the muscle, and I'll show you in a minute what exactly happens. It's not the same person, but for illustration purposes, an action like this, where she is in such kind of first of all, she's airborne, right? She's jumping, she's twisting, she's turning her torso. She is going to be throwing this ball, and this is what's going to happen most likely. Here we are looking at delta t. Delta t is basically the difference between 2 points of reference. So if we're looking at this versus this, D will come before E. So it's actually inverted. So you will have here this area, D1, is the temperature, the average temperature is 34.2 degrees. And then this area here is E1, which is 33.7 degrees. So you're looking at half a degree difference, which is quite significant because, look, it's the same person, and yet we have half a degree difference between this area and this area. What's even more important is that when you twist like this, you're going to be twisting all sorts of things in your lower back as well. And here you have, again, delta T between 33.9 and 33.4 is another half a degree difference. Here is the site of injury for sure, okay? So we have one injury here in the thoracic and one injury here kind of in the lower spine as well. We have other sites that we can measure as well, but this is a clear indication of what happens when you get into a very unnatural position like this as well, even for a trained person. And that's how analysis is being done, because you can see here, there's a problem here, there's a problem here. And all these problems, as I said, always we compare left to right or right to left, whether it's here or whether it's in the lower back as well. Here's another case study of a 25-year-old Brazilian swimmer. The main event is 200-meter butterfly. Again, the butterfly position in terms of swimming has a particular kind of load on certain muscles. So in this case, it represents an overload muscle, which is consistent with his complaint. To avoid future injury, some mechanisms of athletes recovered were established. So they were doing compression boots, they were doing electrotherapy, sports massage, and after 2 days of treatment, the average temperature of the legs was reduced by 1.1 degree. Quite significant. You can see here, in this particular case, red will represent hot because it's higher temperature. and then yellow here will represent lower temperature. So you can see clearly, as well as the tibial temperature below the knees here, as well as here. So this is, again, how thermography could be used, one, to establish the baseline, and whether it's 2 days or 3 months, doesn't really matter. You can follow up and see what happened after. We also have adductor muscle issues, because if we have any swimmers who are into freestyle, whether it's freestyle or anything else, with freestyle, you know, your legs are going like flippers, this way and this way. So as you flip your legs, you're using a lot of the adductor muscle, which is very kind of high up in your thigh. And this adductor muscle, as you can see here, is definitely strained. Again, we can look at this a day or 2 days later, and then you can see that the adductor muscle is either getting better or not getting better. And that's how we use thermography in this particular area. So we can see here that the medial region of the left thigh was 23, in the contralateral region was 22 degrees, right? So even that minute half a degree difference makes a huge difference to this particular athlete. The next one, traumatic injuries, right? So with trauma, specifically, again, the rupture of the right knee, and we are looking at, again, before and after treatment. So before, right after an event, we can see that there is a problem with rupturing of the knee, which is a very, very painful issue. But it seems to be that the alpine skiers are very prone to knee injuries. I know a couple of people that just recently, it wasn't really a knee injury, it was like actually fibula that was ruptured, very painful. But in this case, you can see before and after. A couple of months later, you're looking at 3 months. Again, fracture of tibia and fibula. 3 months later, even though this particular individual is still complaining about some discomfort, there's definitely quite a difference when you look at images here and previous. So what are the methods and techniques? What's the kind of the new thing that's coming on with thermography? As I mentioned, the thermal imaging has evolved to analyze musculoskeletal disorders basically by looking at thermal signatures to indicate underlying conditions. And what's the new thing, well, maybe not that new, but new relatively speaking, is what is called mapping. What is mapping? So you take very kind of symmetrical points of reference, and you apply them to the imaging, which I'll show you in a second. So that can reveal inflammation, muscle strain, certain abnormalities in terms of joint function. And what is important here is that no other type of imaging modality gives us the same information. So again, it's not that thermography replaces, let's say, an X-ray or replaces an ultrasound. Of course it doesn't, but it can be used, as I said, in real time, which is very important. So conditions like arthritis or soft tissue injury, which is not going to be shown on many other kind of imaging modalities, that's perfect for thermal patterns that will provide key diagnostic clues. So here, I know when you're looking at it, the first time I looked at it, I got a little confused too, but let me explain what is it that you're looking at. The A is your before training. So you can see the upper body of this individual. And all these things are what do we call mapping. So we're mapping, let's say, 0.5 to the opposite side. We're mapping 0.3 to the opposite side. So it's basically some kind of a grade system. Now, in the following, immediately after training, so you can see how the vasculature and the heat distribution has changed quite significantly, especially in and around the heart area here. And then 10 minutes after training, as this person is getting cooled off. Now, if you're not cooling off appropriately, and what I mean by appropriately, in other words, if you're not cooling off symmetrically, as you can see here, then there is some kind of a physiological issue here. Or if one side is cooling off better than the other, or faster than the other, then there's some kind of an issue here as well. So you can detect injuries or potential injuries based on before, during, and after training. And the same thing with the back. Again, if you're looking at this rectangle, this one is going to be compared exactly to this one. Why is it kind of important to do this? So again, as machine learning becomes more and more proficient, we can look at the area 7 and compare and get the average temperature instead of just going for one or two particular spots that we see. Again, you can see how the distribution becomes very broad and how, in this particular case, the cool down occurs. And as you can see here in the left trapezium, the cool down is not symmetrical to the right trapezium. So is this a site of potential injury, or is this a site of already something that's going on in terms of injury? I don't know, but it's an interesting kind of way to see it. And this is what we call, by the way, kind of dynamic thermography. I keep referring to this term when we do, for instance, breast imaging and analysis. It's very important to do a dynamic thermography, not just to take one set of images and then say, well, you're high risk, you're low risk, whatever, but see how after the cold challenge, how this dynamic thermography gives us additional information. So instead of waiting 10 minutes, or instead of waiting 3 months and imaging these people again, we can kind of quickly do a simulation, if you wish, by using cold water challenge, as we do, to see how you cool down and whether there's some asymmetry in cooling down. And here we are looking at lower extremities. Again, any deviation from normal or symmetrical cool down will give us an indication of what else is going on. Again, this is done on cross-country skiers and swimmers. And this is your kind of at least my understanding of imaging before, after, before and after. Very kind of important concept to understand how to properly map things for different type of evaluation. Again, in this particular case, you can see visually that in this case, right trapezium musculature is asymmetrical compared to left, and so on and so forth. So I realize not everyone is kind of into it the way I am, but I can see things quite quickly, the problem areas. So what are the advances? Well, as I mentioned before, in sports medicine, the innovation is coming, whether we like it or not. The advancements will allow immediate detection of acute physiological changes. So you can see here, naturally, you're not going to take this athlete, do it on the field, although you can do it, but you can probably go into their dressing room and image with your handheld device. You have a laptop to visualize that image, and immediately you can say, oh, I see a problem area. I don't think that you're going back on the field. You're going to be sitting out the rest of the game. If you're not going to sit out the rest of the game based on our assessment, you may be sitting out the rest of the season. So, as I said, it's very important. So the technique includes rapid scanning of athletes post-performance or during the performance to detect the areas of potential tissue damage. It could be increased blood flow or reduced blood flow. That's facilitating a quicker intervention. So that's why I wanted to bring this up, because thermography can be used in so many different ways in sports medicine. Again, just kind of from the Institute of Physics of Engineering and Medicine. Here we are looking at kind of cyclists, but it could be used on just about anything in terms of sports science and exercise, in veterinary thermography, including maintenance of factories, firefighting, you name it. Anywhere where we're looking at heat differential, we're probably looking at using thermal imaging as well. So what is the future? The future is here and now. We're looking at integration of wearable technology. As many of you already have, let's say, an Apple Watch or something other than an Apple Watch. There are many other wearables. Now, they're basically kind of taking some of the kind of thermal input that we're getting from the skin and utilizing that in different ways. So naturally, they're not using thermal imaging, but with wearable technology, we're also going to be getting monitoring of athletes' physiological status. They're doing this already. There's nothing new, but artificial intelligence and machine learning, as I mentioned before, that's going to kind of grow by leaps and bounds with algorithms that will analyze thermal images more accurately and naturally faster as well. And finally, enhance recovery protocols. Remember that to monitor recovery and different stages of rehabilitation, again, thermal imaging is basically indisposable when it comes to musculoskeletal injuries. What's also important is because the technology is very pictorial. In other words, you can show your patient, here's before, here's after. I remember years ago, we had a local chiropractor that wanted to kind of do a study where he brought a bunch of his patients, we imaged them, then he used a particular therapy, and then we used thermography again an hour or 2 hours later, I can't remember exactly. And there was quite a significant change between before and after. We gave them all the images, and then I remember flying on Air Canada locally here, and as you know, many airlines will have their own kind of en route magazines, and lo and behold, I see an image that I've done a couple of years before, so that was quite interesting to see. The research, as good of the protocols that we have, we need to validate them. Naturally, we need to refine them. There's no end to this. We can continue to improve. We can develop non-invasive diagnostic tools. And as I said, I keep emphasizing the most important thing about thermography is not that it gives you kind of information in real time. The most important thing is that it's non-invasive. Again, you're not going to use X-ray machine every other day or every week. That's not feasible. With thermography, you can. And then you can use the information that you're getting to customize specifically for training, for recovery, and you can, basically every single person is going to be individually treated. That's where it's going to be completely optimized for these athletes. Finally, just a few key takeaways. Remember that thermal imaging can enhance athletes' safety. Second, it's going to improve their performance if it's used properly. Thirdly, we can have an early diagnosis and quick intervention. And finally, with an ongoing research and technological advancements such as machine learning and all that. And by the way, I've come across so many published studies when I was looking at preparing for this webinar. It really is mind-boggling what's going on out there. And by the way, speaking about studies, here is something that was used for this particular webinar, but you know, at some point in time, I had to kind of cut it short and say, okay, this is not going to be in great detail, but I just want to broach the subject, give a quick introduction to this particular subject, give to our practitioners an idea of how thermography can be used if they are treating athletes, or not just treating athletes. There are a lot of people that have injuries, and this can be used just as well. And finally, just wanted to bring to your attention that as a Canadian Association of Clinical Thermography, we are committed to making sure that the key imaging tool in healthcare that practitioners seek, and we are dedicated to providing knowledge and information about this particular technology. I've been doing this for a while, but to those of you who are new to this, thermal imaging really holds a transformative potential in healthcare. And it really is a groundbreaking technology. If you want to connect with us, we're always happy to hear from people in the industry or outside the industry. And please connect with us at connect@thermographycanada.com, or you can even call us if you like. Here's the phone number, here's the email address. And now, with a few minutes that we have left, maybe we can have a quick Q&A session.
All right, great. Well, that was really informative. Definitely a lot of interesting information. And maybe some of us will go into professional sports, make millions of dollars going on the field.
By the way, we're all athletes.
Okay, well, actually, so kind of to that end, so here's a question, what if someone isn't a professional athlete per se? How can thermography help someone if they come well after performance, like regular exercise, weightlifting, etc.?
Right. Again, you can do the same assessment as I mentioned before, whether someone's professional or not professional, or someone who's not even an athlete or not considering themselves an athlete. You can do the same kind of evaluation to prevent injuries. And also in terms of your physical kind of training and assessment, thermography could be used the same way. So we call it kind of sports medicine, but not everyone is an athlete and can be used for lay people as well. I remember years ago when I was playing tennis, because of my poor technique, I used to get kind of tennis elbow all the time. So I'd run to a chiropractor who would fix me. But you can do before and after the tennis game to see what exactly is going on in terms of your injury. So you can develop certain treatments and techniques to avoid that or to minimize that particular injury.
Actually, something that also comes to mind as you're speaking about preventing. So, yeah, and you spoke about this during your presentation as well. Sometimes things appear when there's no symptoms. So,
Yeah.
so in terms of prevention, if someone already has symptoms, of course they can still come for thermography. But it seems like this is a good assessment to do just in general to see if there's any heat displaying, especially when there are no symptoms, so to prevent further injury.
We all have so-called weak points or predispositions to certain things. There are some trigger points trigger points in and around the back, usually in the trapeziums, as I mentioned before. It's the way we sit. The way I'm sitting right now, even though I'm not particularly twisted, but I feel more so on the right side as well. And I almost guarantee you that if you were to image me right now, this area here, the right trapezium, would stand out. Now, I feel it, but before I felt it, I'm sure it was there. The temperature would be different. So even when I don't feel it, now this is the area for me to figure out, how do I fix this? Do I need to go to a professional to do this? So it gives me an idea where to go first, right?
Great. So a couple other questions. One is, where can one get imaging done if they don't have their own system? Because you talked about pulling out your handheld system.
Yeah.
So you can definitely go to thermographycanada.com and you can see a list of places that exist within our CACT association. So that's one answer for you, depending on where you're located. And if you need further help, you can definitely contact us at connect@thermographycanada.com or call us. And Julio is saying, thank you very much for the presentation. Which thermal imaging camera do you suggest using? So if you're, I mean, I can leave that to you, but if you're someone who's looking to start offering thermography, that is something that we can also give you information about. But I can just put that to you if you want to say anything, Dr. Mossboy.
Yeah, the camera, it all depends on the application that you need. For instance, if you are looking at, let's say, real-time sports medicine, probably a handheld camera is more suited. If you're looking at stationary stuff in your office, you don't need handheld, you need more of a stationary kind of equipment. It's not just the equipment, it's also training, who is going to be interpreting the images and so on, what type of training is needed. So that's why we started the Association of Clinical Thermology a few years back, because it needs to be standardized. It's not just a matter of getting equipment and heading out into the field. As I said, my job is to make things that are complicated look simple. That's why I'm getting the big bucks. But the issue is proper training, proper kind of procedures, interpretation. Equipment is not even in the first three, the most important things. Education and interpretation and proper protocols are definitely in the top three. But again, if you, depending on what your requirements are, please contact us, because it's all very, very kind of different for different people.
That's great. Okay, fantastic. Well, if you didn't get your question answered and you still would like to, you can always send us an email, connect@thermographyclinic.com, thermographycanada.com, sorry. And with that, we're going to say thank you again for showing up, and thank you for the questions and for your interest. And thank you, Dr. Mostovoy. That was a really great session, and we will send out the recording as well.
Thank you. Thank you all, and hopefully we'll continue doing this on a monthly basis. As I mentioned before, if you have certain interests or subjects that you'd like us to cover, by all means, contact us and let us know. I'm always looking at new things for me to learn. So until further, I want to wish everyone to be in good health, and we'll see you next time. All the best.